Hello, my name is Tria Lowen, and I am a peer support worker working with parents with children who have eating disorders. Eating disorders are a serious illness that can affect how a person thinks, feels, and behaves with respect to food, eating, and their bodies. There are several different types of eating disorders. One of the most well-known eating disorders is anorexia nervosa. Anorexia is characterized by behaviors that interfere with the maintenance of sufficient body weight, including significant restriction of food intake and an intense fear of gaining weight. Bulimia nervosa involves periods of food restriction, followed by binge eating, which is the consumption of large amounts of food in a very short period of time, along with the efforts to make up for that behavior, such as purging, vomiting, and other restrictions. Binge eating disorder involves episodes of consuming large amounts of food very quickly and often in secret. But this comes without the compensation of purging that characterizes bulimia. There is also avoidant restrictive food intake disorder, or ARFID for short. ARFID is not focused on body image or fear of gaining weight, but instead individuals may avoid food due to sensory sensitivities, experience extreme negative reactions when offered unpreferred foods, or have had negative or traumatic experiences involving food. People of all shapes, sizes, and genders, ages, and backgrounds can have an eating disorder, and no one should be dismissed or overlooked by their parents. If your child is struggling with eating, food-related anxiety, or body image, we want you to know that you are not alone. There is guidance available to support you. Across Canada, healthcare providers use national practice guidelines to help them inform eating disorder care and treatment. These recommendations are based on the best available research. They help ensure that adolescents get the right support at the right time and recognize how important your role is as a caregiver. So what do the guidelines recommend? For youth with eating disorders, family-based treatment, or FBT, has the strongest recommendation, especially if the illness has lasted less than 3 years. As a caregiver, you are placed at the center of care, helping your child eat and recover with support and coaching from your healthcare team. Other therapies like cognitive behavior therapy, or CBT, or multifamily therapy, MFT, may also be recommended depending on your child's needs. Cognitive behavior therapy will focus on individual therapy, helping your child address repetitive thoughts and harmful behaviors. Multifamily therapy will involve you, the caregiver, through workshops delivered to multiple families at the same time. So what can you expect as a caregiver? You'll be working closely with a team. This might include a doctor, a therapist, a social worker, a dietitian, and other professionals who understand eating disorders. Depending on the situation, care may be provided in different settings, and your child's team will help you navigate through these treatments. Outpatient programs are common for those that are medically stable, allowing the youth to live at home while attending regular appointments. Day treatment offers a more structured setting without overnight stays. Inpatient care is reserved for youth with serious medical complications and focuses on short-term stabilization in a hospital. Your involvement isn't just helpful, it's vital. The guidelines highlight that caregiver support is the key component to recovery, as well as in transition between treatment settings and between pediatric and adult care. We know this journey can be overwhelming. You may feel confused, scared, and unsure where to start, but that's okay. Your child's care team is there not only to support them, but to support you. If you are looking for more information or simply wish to understand what support looks like, Talk with your child's care provider or visit Canadian resources like Body Brave and NEDIC. A full summary of the guidelines as well as an accessible virtual guideline synopsis are available to you at couturierlab.ca.